What is HbA1c? HbA1c is a term which is often used and heard when talking about blood sugar level in relation to diabetes. This term refers to the condition when glucose is present in the red blood cells, hemoglobin, in our bloodstream. The more glucose we have in our hemoglobin, the more molecules of glycosylated hemoglobin or HbA1c we have in our blood. This HbA1c is also called A1c, and it is important to know this term if we want to be more knowledgeable about diabetes. What is HbA1c test? HbA1c test is an examination performed on the diabetes patient's blood to measure the level of glycated hemoglobin in their blood. The test, which is often identified as a glycohemoglobin test, will show some results used by the doctor to find out whether the patient is able to control the diabetes or not. Patients with diabetes need careful monitoring from the physician, and this HbA1c is one of good ways to know whether the disease is getting controlled or not. The test is usually performed after 6 to 12 weeks of the given medication and other treatments. How to perform the HbA1c test? There is no special preparation needed to conduct HbA1c tests. Patients will just undergo similar blood tests which are often conducted to diabetes sufferer. Some doctors will just take blood sample from the finger stick and analyze it in the laboratory. Some others, however, will need to take the blood from your veins, so you will need to undertake venipuncture. Why is HbA1c test performed? For patients with diabetes, this HbA1c test is really important to see the level of glycated hemoglobin in the blood. Hemoglobin is very important to transport the oxygen to all parts of the body, and the excess of glucose stuck in hemoglobin will definitely decrease the amount of oxygen that hemoglobin can carry. The more glucose, the less oxygen, and the weaker the diabetes patients will be. The HbA1c test is needed to measure the glucose level to know whether the patient needs medication or not. Results of HbA1c tests. After the HbA1c tests are conducted, the doctor will explain to the patients whether their condition is normal or not. Usually, the doctors will explain the level of HbA1c to each patient, so they know whether they are improving or getting worse, and although some doctors have different opinions on this, the main classification of HbA1c test results are described as follows: normal. People with 4% to 5% HbA1c test results are not having problems with diabetes, so nothing is to worry about. Prediabetes. If the result of the test is between 5.7% and 6.4%, it indicates that the person has some risks of diabetes. He has to start limiting his food intake, and also consult with the doctor to get an advice to keep it lower. Diabetes. Once the result of the HbA1c is higher than 6.5%, the patient must take very intensive treatments for diabetes. They have to keep the level between 6.5% and 7%, because studies have shown that people who do not control their level and let their glycated hemoglobin go over 7% start having diabetes complication. The HbA1c level should ideally be checked every 3 months, especially for the diabetes sufferers, to monitor the level and keep it below the risky level. HbA1c is an important test, and it should not be neglected as it can provide important information for your current doctor. Based on this test results, the further procedures will be implemented in diabetes management. More about HbA1c test in diabetes at www.cureforddiabetes.co.uk.